Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. This is the time of year when we all need to pay attention to the possibility of tick-borne illness, diseases that can be spread through being bitten by a tick. Joining us now to talk more about this, Dr. Arti Barnes. She's the medical director for the Illinois Department of Public Health. Dr. Barnes, thanks so much for your time.
Thanks for having me, Jim.
Well, how common is tick-borne illness here in Illinois, and what forms can it take?
So there are many things that can be considered tick-borne illnesses. You may have heard of Lyme. You may have heard of Rocky Mountain spotted fever. Also some parasites called babesiosis. And of course, you have all heard of West Nile. There are other kinds of pathogens that, infections that we can get through ticks. So ticks can help carry bacteria, viruses, parasites. And in Illinois, what we see the most of is Lyme disease. Just in 22, there were over 250 cases of Lyme that we were aware of in Illinois. Similarly, we've had over 100 cases of West Nile virus that we see both, insect-borne tick and mosquito-borne infections very commonly in Illinois.
And we'll talk a little bit more about West Nile. We'll also be talking at length about Lyme disease a little bit later on with the Illinois Lyme Association. But let me just ask you some basics about Lyme disease. As you noted, it's one of the most common of tick-borne illnesses. What is Lyme disease and how does it affect someone who contracts it?
So Lyme disease is by a bacteria that infects what we call the black-legged tick. And so this black-legged tick, we get exposed to in the woods when we're walking our dogs. It latches on, it bites us, and transmits this bacteria that's inside it. And this bacteria can linger in our body, incubate, so to speak, for anywhere from 3 days to almost a month. And in that time, once it manifests, you can get fever, headaches, just feel a lot of fatigue. And a lot of people, about 80%, may have a rash. Now, you might not even notice the rash, but it's a large rash, gets over, several centimeters in size and almost spreads outwards like a bullseye or a target. And that's a classic rash that people see with Lyme. But again, you might not notice it. It may be on a part of your body that you may not be aware that was bitten by a tick. And if untreated, almost like 60% of people who don't get treatment for Lyme can progress to having conditions that really impact the other parts of the body. You can have complications in your heart, in your nerves, your joints, your brain. So it's very important to be able to know if you've been infected by Lyme, that you're able to get treatment as fast as possible. And also it's important to know that if you are in an area where ticks have a lot of Lyme, not all ticks have the bacteria that causes Lyme, but if you are in that area then and you've had a tick that's latched onto you for more than 3 days, like at least 72 hours, and has been engorged, you can actually take a pill, but it has to be within 72 hours to prevent getting Lyme. Now, not everyone will need it. Not all parts of the country need it. So CDC has a great tool where you can go to their site. It's called Tick Removal Bot. It tells you how to remove a tick and whether you need what's called prophylaxis or a preventative to protect you from Lyme.
And if someone does contract Lyme disease, can it be cured? Is this a long-range illness? How is it treated?
Yes. So if you contract Lyme, there are many stages. An early stage, I mentioned, you could just get that rash that expands. In a later stage, it can affect your heart, your brain, your nerves. And so it's going to be very important to make sure you get on the right antibiotic. The most common antibiotic we use is something called doxycycline, used for many other things too. And you take it for about just, 10 to 14 days in the early stages. You have to take it a lot longer, up to a month in the late stages. So the sooner you find out that you have Lyme and are able to treat it, the easier the treatment is and the shorter the treatment is.
And again, we'll be talking more about Lyme disease coming up with the head of the Illinois Lyme Association. We're speaking right now with Dr. Arti Barnes, medical director at the Illinois Department of Public Health. Lyme disease, as we mentioned, is just one tick-borne illness that shows up in Illinois this time of year. What are some of the others that people should be aware of?
One disease that's fairly deadly is Rocky Mountain spotted fever. And that is spread not by the same tick, the black-legged tick that spreads Lyme, but by another tick. It's called the American dog tick, and it's very common. Now, the good news is that it's not very common to get Rocky Mountain spotted fever, even though the dog tick itself is very common. And we've only had about 18 cases of what we call spotted fever rickettsiosis, so that umbrella of infections. But if you get Rocky Mountain spotted fever, within a couple of weeks of that bite, you'll start experiencing a fever. As soon as you get a fever, go to your provider, make sure you get diagnosed, and treatment should start within 5 days of starting to feel sick. So within 5 days of that fever, of starting to feel muscle aches and pains, and you may or may not see a rash. The rash that's how it gets its name, the spotted fever. You get a rash, it's usually on your arms and legs, and it can be really deadly. Up to 20% of the people who don't get treated may not survive this infection. So while it is thankfully very uncommon, we've only had, again, less than 20 cases, the whole umbrella of spotted fever infections. We are vested in making sure that people are aware and get tested and treated fast if they get a fever after a tick bite.
Clearly, this is something to take seriously. The good news is that there are ways to reduce and prevent the risk of infection. What are some of the precautionary steps people should take to try to avoid contracting a tick-borne illness?
So the most important thing to do is to prevent the bite. So we have a campaign called Fight the Bite, and that is where it all starts. So when you're outdoors walking the dog, and as I speak as a dog owner who walks on the trails and has been bitten by ticks, you got to make sure you wear lightweight clothing and light colored clothing that is easy to spot a dark tick on. Make sure when you come back indoors that you do a quick body check to make sure that your children don't have any ticks attached to them. If you do find a tick attached, it's really important to make sure you pluck the tick out carefully. Now, the mouth parts of the tick can really stay in your skin if you just yank it or jerk it out, and it can still cause infection. So it's really important to make sure you take the tick out properly with tweezers. Both the IDPH and the CDC side have some great visuals and some great instructions on how to take a tick out. Don't try to squeeze and burst the tick with your fingers. Try to avoid touching it directly with your fingers if possible. Most people use tweezers. And, don't use nail polish and other home remedies to try to take out these ticks. Once you've taken the tick out, you can either take a picture of it to show to your provider, especially if you've been bitten. I mean, if they were just crawling on you, it's really not concerned. But if you were bitten, you can take a picture, show your healthcare provider to make sure you can identify the tick. Some people save it and take to their healthcare provider if they're going to seek medical attention. But the key thing is Lyme really is a concern only the tick has been on you for over 3 days and has been constantly feeding. If the tick just landed and you took it out, really unlikely that you would catch any infection from it. So again, it's going to be important to take the tick out. Some people are also comfortable putting insect repellents and tick repellents on their bodies. Putting it on your skin, DEET, at least 30% is helpful in reducing the odds of the tick biting your skin. And if you just want to use more clothing that's permeated with insect repellent, then often people use a product called permethrin to use on their clothes that repels insects.
Again, much more information on this at dph.illinois.gov or at the CDC website. Dr. Arti Barnes, before we let you go, a couple of other questions. One has to do with a story in the news recently about the discovery of a new tick species, at least new to Illinois. It's been in other states, but now spotted here for the first time, the Asian Longhorned tick. Why is this significant, and is there any health concern for humans?
So this tick has been identified in many parts of the world. Now that we're starting to look at our own tick populations, we've discovered that it's been in the U.S. for longer than we think. It seems like it has been around since 2010. But the main concern with this tick is what can do to animals. A large infestation of Asian longhorn tick can engorge itself with a lot of blood and almost drain an animal of blood, cause severe anemia, blood loss in animals. So humans, it doesn't really bite humans as much because it's not as attracted to human skin, and it doesn't really transmit human disease. It's not expected to transmit Lyme. In theory, it could transmit some human diseases, but we've not actually caught it. And these ticks, we do test our ticks for infections, bacteria that can infect humans too. So thankfully, we've not found any in the Asian longhorn tick, but I would say it's going to be important to protect your animals and your pets from getting bit. Now, the same things that protect you from tick bites from one tick protect you from another, and it holds true for the Asian longhorn tick. So insect repellents, tick repellents, including the medications we give to our pets to prevent and protect them from tick bites, those work against this tick too. So make sure you talk to your veterinarians if you have livestock or pets about making sure they are protected.
What's interesting about this is this was discovered through a tick surveillance program supported by the Illinois Department of Public Health. Can you give us a bit of the backstory as to how this was found here?
Yeah, so we do what's called tick dragging, and we are a phenomenal vector-borne team and our environmental health team work with local health departments to help them conduct surveillance where we drag the outdoor areas for ticks. And then we test the ticks, not just to see what type of ticks there are, because different types of ticks carry different infections, but also to see what kind of infections are in those ticks. And so we discovered for the first time the Asian longhorn tick in Illinois in one of our counties.
Very interesting. Again, more on tick-borne illness coming up in just a moment. Before we let you go, you did mention earlier another disease spread by insects, in this case mosquitoes, and this is the time of year to also be thinking about West Nile virus. What do people here in Illinois need to know about that?
So we really urge people to do three things when it comes to preventing West Nile, specifically mosquito bites: reduce, repel, and report. So as the rains get more intense and we start seeing a lot more waterlogged areas and stagnant water bodies, it's going to be important to, one, protect yourself from mosquito bites. Make sure you have screens on your doors to prevent mosquitoes from getting into the house. Make sure you wear insect repellents or mosquito repellents on your body. That the right type of repellent will make a difference. So in reducing those bites, and make sure your skin is covered for the most part when you're outdoors with, again, light clothing that's both light in texture so you don't get overheated in the summer, but as well as light in color. And also to make sure that if you see large water bodies like ponds or stagnant water in your neighborhood or in the area, report that to your local authorities so that they can take care of it. And so those are ways to prevent mosquito bites. And especially, as I said, mosquitoes can contain the West Nile virus that they can spread to humans.
Let's turn our attention back now to Lyme disease as we continue our discussion of tick-borne illness. We want to dig more deeply into this, which is one of the most prevalent and dangerous of tick-borne illnesses, Lyme disease. And with us now is Jen Russell, founder, CEO, executive director of the Illinois Lyme Association. Jen, thank you for your time here. Let's begin by talking about the formation, the creation of the Illinois Lyme, L-Y-M-E Association to deal with the effects of Lyme disease. How and why did you form this organization?
Thank you very much for having me. So we began in November of 2018 after my daughter had quite an extensive journey to get diagnosed. She was 7 when she first got sick, and we spent the next 3 years of tests and more tests and constant blood work trying to figure out what was wrong with her. You know, at her sickest, she was sleeping 12 to 16 hours a day, living on pain meds, and had lost most of her short-term memory. She was finally diagnosed because our dog got Lyme disease, and obviously he was quickly diagnosed. But through our journey, we met so many more people that had the same story, but different, all as equally devastating. And many had lost their homes on disability and had an extremely difficult time getting diagnosed, spending far too much time trying to figure out what was wrong with them, and really needing someone to help them find a voice. So we formed the Illinois Lyme Association, and we currently have about 1,800 members and growing daily.
I want to just, again, point out how remarkable that is. You couldn't get a diagnosis on your daughter for the longest time. Your dog was diagnosed immediately. That says something about the situation that lots of families dealing with Lyme disease are going through.
She had quite a journey. So it actually started when she was in first grade. I heard the bus come home and drop her off and leave. And she never came into the house. And I went outside and found her lying in the driveway. She said that she was too tired to walk and that her legs just wouldn't work anymore. She had a low-grade fever. And through the course of the weekend, we ended up in the ER. Her white blood count was so low that we actually were transferred to a children's hospital because they thought that she might have leukemia. Thankfully, they stopped a bone marrow procedure because her blood levels had increased slightly, and they sent us home just saying, we don't know what's wrong with her. She was out of school for the next 3 months. And, like I said, we spent the next 3 years in and out of doctors. And in second grade is when she lost most of her short-term memory. And third grade, she started having some sort of seizures. And fourth grade, another big decline happened. And that's when the severe symptoms set in and she was sleeping all the time. She was having serious brain fog and cognitive complications. And, there unfortunately were days that I had a 10-year-old Alzheimer's patient. She didn't know what a laundry basket was called. She couldn't remember what a chair was called. She could no longer do kindergarten math and was living on pain meds at that point. And it really wasn't until she had 3 bullseye rashes appear in her armpits 3 years later and still had several doctors deny that Lyme was a possibility. And then it was shortly after that, then our dog got bit and developed the exact same bullseye that I finally got providers to start looking into Lyme disease.
So you created the Illinois Lyme Association to assist people like your daughter and their families. What sorts of services and resources do people who are dealing with Lyme disease need?
Navigating the health system when you have Lyme can be very difficult. Many providers don't believe Lyme exists. You're really on your own and you have to be your own advocate. So this is where the Illinois Lyme Association can really help. Patients need access to reliable testing that's covered by insurance. They're out there, but you do have to know where to go. Access to treatments that don't cost a fortune and are covered by insurance. I've talked with many that have spent tens to hundreds of thousands of dollars on treatment trying to get better. Doctors with the knowledge base to treat some complex cases of Lyme, which are so few and far between. We have a few in Illinois. However, most are booked so far out that if they're even taking new patients at all. So they're really inundated with people looking for help. The Illinois Lyme Association has a list of providers that we send out to members as a resource. But we also really need disability resources, such as how to go about applying and healthcare professionals that are willing to help document disability in some of the sickest patients. So research from LymeDisease.org, it's a national nonprofit for Lyme disease, published a study in their patient registry showed 42% of patients reported that they had to stop working due to the level of their chronic illness. And we need more mental health professionals that understand the complexities of Lyme and tick-borne disease.
Let's talk about that. You've already talked about some of the debilitating physical symptoms that patients may have, but during this Mental Health Awareness Month, it's noted that Lyme disease can also lead to mental health issues. What are some of the ways that plays out and what help is available?
So May is also Lyme Disease Awareness Month. So Lyme and mental health really need to be discussed. Unfortunately, we very recently lost someone in our Illinois Lyme community. Many are struggling. So several scientific research studies are showing microbes are associated with a number of mental disorders. Mental health implications extend well beyond just depression and even suicide. Patients who received a hospital diagnosis of Lyme disease, including inpatient, outpatient, and emergency room visits, had a 28% higher rate of mental disorders, according to research in the American Journal of Psychiatry. So mental health symptoms caused by Lyme that are very common are anxiety, depression, suicidal thoughts, sleep disturbances, brain fog, cognitive issues, rage, bipolar disorder, and other mental health conditions. Isolation is very common as well. So many express depression because no one, their family or medical providers believe that what they're experiencing is real. So this in turn isolates them even further. So a quote from a Columbia-led study that I wanted to read today was, treating clinicians and patients should be aware of an increased risk of mental health problems, particularly during the first year after severe Lyme disease infection. And if mental health issues arise, patients should seek treatment and guidance. We have provider groups that we refer members too if they need to talk to someone that understands Lyme and tick-borne diseases. But due to our recent tragedy, we are looking for a grant to help that would allow us to provide small group counseling as well. We do also offer a freelance writing program, and we do a monthly virtual support meeting on the third Tuesday of every month.
We're talking with Jen Russell. She's the head of the Illinois Lyme Association about Lyme disease. And you talked about your own experience and the years it took for your daughter to be diagnosed. How often is Lyme disease misdiagnosed, and what can be done to make sure it is found and addressed early?
So we really don't know. There's currently is no tracking of patients that are diagnosed later. So that LymeDisease.org published study I referenced earlier also states that out of 2,424 people, only 7% were diagnosed correctly. 84% of Lyme patients were not diagnosed within the first 4 months of illness. 51% stated that it took over 3 years before they were diagnosed. So Lyme is known as a great imitator. The symptoms are so broad and they cross with so many other illnesses and diseases that it can be difficult for a provider to identify Lyme. There's a small group of people in Peoria area that live fairly close geographically. They have been diagnosed with ALS, and one of them found out actually that she has Lyme disease and is about 80% improved with treatment. Since then, several of the others too have tested positive for Lyme and are improving. I believe raising awareness with the medical community is a huge step to make sure it's getting diagnosed right away. 95% of Lyme patients get diagnosed by their primary care provider. I run into providers that don't realize Lyme is in Illinois. When we were trying to get my daughter diagnosed, several providers told us that Lyme was an East Coast issue and not in Illinois. This is no longer the case. A couple of years ago, IDPH had a social media campaign called Lyme is Here. And that's a perfect statement because, in fact, it is here. In 2012, Yale University published a warning that listed Illinois as an emerging risk for tick-borne disease. And the CDC issued an alert to neighboring states of an endemic state for providers to be aware and looking for the potential for tick-borne disease. That was in 2017. So that was 7 and 12 years ago. And you can see we have a growing risk when you just look at the IDPH tick surveillance maps, which are great, by the way. I definitely encourage everyone to check those out. Our northern counties have deer ticks testing at a much higher rate, many over 50%. Any county with over 25 ticks is quantitative for the entire county. So the map clearly shows the deer ticks moving down from Wisconsin to mid-state. And deer ticks are expanding throughout Illinois in both rural and urban settings. Lyme disease and other tick-borne disease present an urgent public health concern, and our residents have never been more at risk. Lyme disease is the most common tick-borne disease. Other pathogens deserve attention. You have the Gulf Coast tick and the Lone Star tick coming up from southern Illinois. Alpha-gal syndrome is a potentially life-threatening red meat to allergy associated with Lone Star tick. Is widespread, especially in southern Illinois. I spoke to a gentleman from Carbondale area recently, and he indicated that everyone on his street has alpha-gal. Providers need to put Lyme and tick-borne diseases in the front of their minds and not the last. I really believe that the CDC reporting criteria are part of the problem as well. So at this time, only acute cases are tracked, meaning a person was bitten and diagnosed right away. Lyme cases aren't counted like COVID, that any positive test is a positive case. So with Lyme, if diagnosis is delayed, they will never be a counted case. And because of this, our human case numbers are extremely low. And this gives our Illinois providers a false viewpoint that Lyme and tick-borne diseases are not a risk in Illinois when they most definitely are. Also, providers need to be aware of testing limitations. The test is an immune response test. According to the CDC, it can take up to 6 weeks for patients' antibodies to build an immune response to get a positive test. By then, the bacteria is disseminated and can be more difficult to treat. Also, research has shown that Lyme can lower a person's immune system, which can make it difficult to test positive on an immune response test. So several of the other tick-borne diseases have symptoms that can be very similar to Lyme, which won't be detected on a Lyme disease test. So the provider must order a comprehensive panel that includes testing for many tick-borne diseases and not just the standard 2-tier test for Lyme.
You mentioned among the services that you provide through your organization is linking up patients to support groups. Why is that important for people with Lyme disease?
So support groups are very important because they bring people together that are going through the same struggles. It's comforting to know that you're not the only one. And as I indicated earlier, our organization has a virtual monthly support group meeting on the third Tuesday of every month, where we're bringing in educational speakers that are experts in their field. We also have a very active private Facebook group that allows members to connect so that they don't feel alone and they can lean on each other as well as ask questions or ask for referrals to different types of resources.
For anyone listening who is recognizing some of these symptoms in themselves or family members, we'll have contact information for the Illinois Lyme Association in just a moment. But others may be listening and saying, I want to do more to help. You've laid out a lot of details about a pretty significant health issue here in Illinois. So how can people become involved in the effort to educate the public and help those who have contracted Lyme disease?
So I definitely want to encourage anyone who has had tick-borne disease to get involved and share your story. So your voice is very important. Sometimes it can be difficult to talk about, but your story may just help someone else who has been struggling. Especially share your story of hope that it can take time, but you can get better. So our organization is always looking for volunteers. We have lots of vendor booths throughout the state that we need volunteers for. We have a lot of fact sheets and information on our website that people can download and hand out in their communities, hang up on public bulletin boards. IDPH has several fact sheets also that are great. So talk to your local parks about raising awareness on trails and including adding signage. Talk to your medical providers. If you want to do an awareness event in your area, contact the Illinois Lyme Association and we can help you get that set up. I also would love to encourage all of our local county health departments to get tick information out at their local county fairs. So that's a great time to get information out into the local communities.
And for anyone who may need the help or resources your organization can provide, how do people find and contact the Illinois Lyme Association?
So our website is IL and then Lyme, LYME, association.org. We do have links in there to our patient Facebook group. It is member-based, so they do have to answer some questions before they're, added. We also have a public Facebook and Instagram. Search Illinois Lyme Association and they'll be able to find us. And we are very active, especially right now with it being May as Lyme Awareness Month. So we have a month-long campaign going on. So lots of great information to share on your own social media.
Jen Russell, the founder, CEO, and executive director of the Illinois Lyme Association. Thank you for sharing this important information with us. And everyone, join us next time for another edition of This is Public Health with the Illinois Department of Public Health.